Hello and welcome to this new podcast of the American Journal of Public Health. We are in Minneapolis at the annual meeting of the American Public Health Association. And yesterday there was a terrific session about public health and in particular the state of public health in the Hispanic and Latino community of the United States. We published a supplement about this issue, and the meeting was packed. It attracted a huge interest. And so I'm very lucky because I am now with three people who were involved in this project. One is Cynthia Lebron, Anna-Michelle McSorley, and José Pérez-Ramos. So welcome. I mean, it's fascinating to have a conversation with you because it's something that is very close to my heart, as you know. And so, Cynthia, let's start with you. Introduce yourself a little bit and tell us what's the importance of the Hispanic Heritage Month and how can we relate this to public health?
Oh, yeah, sure. Hi, my name is Cynthia Lebron. As you mentioned, I'm an assistant professor at the University of Miami in the School of Nursing and Health Studies. I'm also the proud president of the Latino Caucus. In terms of Hispanic Heritage Month, it does give us an opportunity to shine a light on Hispanic health. And so I had the good fortune of being involved in several webinars and town hall sessions and QAs with different organizations like HRSA, March of Dimes, and things of that caliber. And I think what Hispanic Heritage does, it allows us to stand up and really say the quiet parts out loud, and then it should propel us forward to continue that work. And so, in shining that light, after those talks that I've been able to lead, my emails have been flooded with people who want to collaborate on projects together or studies and think about new ways that we can help the Latino population, specifically in terms of their health.
So those name month is not something superficial. It's really important.
I think
it
so.
matters for the community, and it's a good moment to bring the issues. And okay,
as long as it's not contained to that month,
yes,
it should be a flashlight.
Yeah.
And then we should carry that forward.
Yeah. But, for us, it's important to know whether it matters for the community that we use that month, or it's something that they consider to be, distant. But so that was very important.
Yeah.
Anna-Michelle.
Yes. Hello. Thanks for having me.
No, my pleasure. So please introduce yourself and tell us about the disaggregation. Health monitoring is very important for us. At the journal, it's a very important section. It's foundational of public health. If we don't measure, we don't know what's going on. And it's not straightforward to follow what's going on in the Hispanic Latino community because it's a very rich, diverse community, different even ways of talking and cultural history. So tell us about what are we doing well in terms of health monitoring in the Hispanic Latino population? How can we improve?
Absolutely. Hi, I am Anna-Michelle McSorley. I am an assistant professor at the University of Connecticut, and I contributed to 3 pieces in the special issue that was dedicated to Latino health. And 2 of those pieces speak very specifically to our data issues and the lack of data disaggregation that we're seeing in our systems to really capture the full scope of heterogeneity that exists within the Latino community. To be Latino, right, means a lot of things to a lot of different people. It is a very strong unifying term that brings us all here together. The Latino Caucus does an excellent job in the public health space in providing that arena. Now, when it comes to data and thinking very intentionally about the groups and communities that are being captured there, we need to recognize that that label applies to Mexicanos, Chicanos, Puerto Ricanos, Cubanos, Dominicanos, right? We come in all different shapes and sizes from different nations. And it means a lot of things to lots of different people. I will say when it comes to our monitoring systems, we're absolutely correct in that that is the baseline that we need to be able to assess what is happening in the community. And unfortunately, largely what we're doing is aggregating up. and collapsing everyone into this larger Latino category. And there are many social and structural determinants that apply distinctly depending on which Latino group we're talking about. So here I can take an opportunity to speak very intentionally about Puerto Rico. Puerto Rico is a U.S. territory and is considered to be included under many CDC or federal government health monitoring data packages and data projects. However, they are often missing, or if they are represented, it is not clear that the data are for Puerto Ricans in Puerto Rico, right? Because we have a large diaspora. We have Puerto Ricans in the States. Nearly 6 million Puerto Ricans live in the States, but we also have over 3 million Puerto Ricans that live in Puerto Rico, and it is unclear when our data systems in public health are capturing that community, and it is extremely challenging to make comparisons between the diaspora and the folks residing in Puerto Rico when we're talking about the migration patterns, because coming back and forth is common. I'm a New Yorican. I was raised between New York and Puerto Rico. It is common. And that has implications for how we assess health. So there's a need for more disaggregation. There's a need for attending to the distinct social and structural components for each of these communities. What we are doing is the fact that we are capturing Latinos. We do have them available in our population demographics. We need to do a better job of disaggregating.
But give me some examples, practical example of how we can do that and actually get the right questions in order to separate the Puerto Rican in New York and those who live in Puerto Rico. I'd like to understand how this would translate in our monitoring system.
Sure. So I can actually point us to an example. The U.S. Census recently did an overhaul of how they're categorizing their different race ethnicity categories and held several town halls to be able to bring back academic and public opinion as to whether or not these categories were really honoring the different groups that they were trying to capture. And there was a real intentionality behind recognizing that ethnicity, right? Hispanic Latino is not the only ethnic category. And for a very long time, the definition that came from the Office of Budget and Management was specific to Hispanic Latino being the only ethnic group. The U.S. Census has now moved past that. Is the system perfect? I think there are many scholars and many folks in the community who would argue that it is not, but it is a step towards recognizing the full diversity that exists in ethnicity.
I could add to that.
Absolutely.
I'll give you another concrete example. I'm currently working on a project using birth certificate data. On the birth certificate data, we ask women if they're Hispanic, where they were born, and their heritage country. That gives us an opportunity to look at very different ways, in different lenses we can apply to this birth certificate data. And the project that I'm working at is looking at Cuban American women. So women that were born in the United States of America with a heritage background versus Cubans that were born on the island. And so it gives us an opportunity to even look at what does it mean like to be born in this country and spend more time in this country in terms of birth outcomes.
So what would the American-born woman answer for your free question?
Yeah. So I can tell you, I said, I'm Hispanic, I am American, I was born, and I have a heritage of Cuban. So very different. Those are different responses for different people, and it allows us to place different lenses on it.
I think I also wanted to add another thing. I think we also have to look at it as a little bit more anthropological. Meaning, for example, in one of the studies that we do, typically we collect this data using surveys, so check a box. But let's open a space for people to self-identify, because sometimes, although it might be harder for the researchers when we do the analysis, it is also what the people really represents themselves. So that's another way of thinking. That's the anthropological way of trying to collect what does really the community believes they feel, how they identify, which type of groups they identify.
Yeah, that's very interesting. And actually, that's going towards more complexity and actually confronting complexity and try to go beyond it is the future of public health. So it's a great point, Jose. Can you tell us about you a little bit, and then I have a question for you.
Sure. I am José Pérez-Ramos. I am an assistant professor at the University of Rochester, at the Department of Public Health Sciences, and I'm a proud Puerto Rican. I'm also actually the vice president of the Latino Caucus.
So, Jose, there is this idea of the Hispanic paradox, but if Hispanic is not correctly measured, does it really exist, or?
Well, this is actually I think, an existential challenge, not fight, let's say, with among scholars. I think we have to acknowledge the previous work that was done, it was published, that actually the data reflects that there was what we call the Hispanic paradox, better health outcomes for people that moved to the United States compared with their countries where they actually came from.
Mm-hmm.
However, there are multiple groups that we need to also think about it. First of all, let's start saying that we're not a monolith group. Let's start saying that. We're very diverse. We already be talking about the diversity in the Latino community. And you're going to start seeing differences in terms of health outcomes when you start measuring first generations versus second generations to third, fourth, etc. And that is really where the Hispanic paradox start to get in a little bit, thin. And that's why we're challenged the Hispanic paradox from that sense. We're not saying that it didn't exist. What we're saying is that perhaps there is something more interesting to study about what's happening for those generations that are born and raised in the United States that for some reason they have worse health outcomes. We might have there's already published.
Worse than the Americans or worse than their parents?
Worse than their parents.
Oh, yeah.
Worse than their parents. Yeah.
Can I add also, we have to acknowledge that the Hispanic paradox was developed in a time where the population of the U.S. Latinos was mostly immigrants, but that's not the case anymore. Over the last 20 years, it's shifted so that the majority of Latinos living in the U.S. are U.S. born. 70% are U.S. born. So when we have these big population shifts, of course, those old research tropes might not follow us into these newer generations.
Yes, accounting for demographic change. I would also underscore that even in the context of a Hispanic or Latino health paradox, longer but harder lives are also something that has been experienced within this community. So even if we're speaking to the fact that there was longevity, the different, again, social and structural factors within society when beginning to incorporate into what the American fabric is, present lots of challenges that lead to difficulties. So we may live longer, but there are also challenges that make it harder.
Mm-hmm. And Jose, what are the challenges, especially for the young generation of Latinos in the United States? What affects their health?
We're talking about social structural determinants, right? Also social determinants of health. Let's talk about neighborhoods, environmental exposures, diet. Let's talk about security, safety. Let's talk about education or lack of. Let's talk about the political environment that we are living. Those are things that will affect and actually affecting our youth access to healthcare. The restriction of even now these days, the reproductive rights for women, right? For immigrants, right? They're coming in. We can talk for hours about all of those factors that are contributors to worse health outcomes for our youth and also the upcoming offsprings.
And to that point, because you mentioned the political environment, when we say political environment, and we say that politics are health, it's very real. And there's, again, different ways that you can look at the very real implications of policies and the legacies that they leave. So we've seen time and time again when we have these anti-immigration policies put in place or some anti-immigration reflection of the policy. For example, like the immigration raid in a meat factory in Iowa. We saw poor birth outcomes in the families that were affected by that immigration raid. For those policies in place where they were doing raids the searches to see if you had papers to show your status, we saw poor birth outcomes in those neighborhoods as well. There's real health consequences to the political environment. So when we have someone saying that Puerto Rico is a floating island of garbage, that anti-immigration rhetoric will be reflected in policies and legislation that will impact health outcomes.
And if I may extend that to also bring us back to the structural, because yes, these systems become embodied and produce these poor health outcomes that we see epigenetic-wise and with birth outcomes. But if we zoom out and think about how decisions are made about resource allocation for the purposes of structuring and providing resources for the healthcare infrastructure and for the public health infrastructure in many of these regions, if we look at Puerto Rico as an example, Puerto Rico is a territory with U.S. citizens who still do not have the ability to vote in a presidential election. And we're having this conversation in 2024 within the context of an upcoming presidential election. And this is a space in which their voices cannot be represented to shape the very policies that will then guide decisions that are made about how to fund their health care and public health infrastructure.
Absolutely. And I mean, it's just incredible that we can, such insults and racist behavior can happen in a presidential campaign. I want to ask you another question from my editorial, perspective, and it's about the language. What's your approach about the importance of having all Latinos knowing and being able to speak Espanol and have access to all the Latino culture in that language? What's your
I don't think speaking Spanish does convert you more or less Latino. Let's start with that. I think that's a misconception. There are a lot of Puerto Ricans, there's a lot of Latinos that don't speak Spanish. So let's be clear with that. There's other components, as you pointed out, part of the heritage that they're proud because they were raised in a family that they always remind them, right? Or they're nurtured with where they're coming from, where their ancestors are coming from, right? So I think that's really important for this communities, So having things or reflecting or even highlight things that are related to their culture is critical to keep growing in this country. And this is a country made by immigrants, and we have to hug that, right? Like it is who we are.
We just had a panel here at APHA on media relations for Latino populations and how to get out health messages to the Latino populations. But one of the things that just kept coming across is that the messaging has to meet the population. So you do have to understand it if your population is majority Spanish speaking or not. But to Jose's point, there are many Latinos in this country that do not speak Spanish. Spanish is not their primary language. And so what does it mean to craft a message for Latinos if the answer is not just simply translation? You see what I mean?
Yeah.
One of the things you have to understand is the longer that Latinos stay here, stay here in the United States, they're going to hold on to parts of their culture. And some of them they might not hold on to, like language or maybe even religiosity. But one of the key things that has really stayed over generations is familismo. So if you craft a message where it's not about the individual, getting a vaccine shot is not just going to save your life. It's going to save the life of your family, of your abuelos and your abuelas. Then now you're creating a message that's specific for Latino populations.
Yes. And I think recognizing that a lot of us are operating in Spanglish as well, right? The more that we sort of shift over time and we feel comfortable in the Spanglish, like that, those elements, the elements of love that comes from speaking Spanish and the connection to culture and ancestry is there. The elements of parts of our education that we experienced in English is also there. So Spanglish is also a space in which many Latinos are operating.
Yeah, but that's a very important message. I'm not sure a lot of people understand because they assimilate, Latino Hispanic with speaking Spanish, and that this is not now the main characteristic, that unify this group of the population. Is a very important message.
Absolutely.
A few years ago, I was invited. I gave the keynote at the Latino Caucus.
Oh, well, you should come and do it.
And so
In Spanish, right?
in Spanish. But I had sent the mission of APHA to Latino friends, in different parts of the world, in Spain, in Argentina, in Colombia, in Cuba, in different places. And I had asked them to translate, the mission of APHA.
Did you get a
You got a
million
lot of
different?
different responses.
You got a million of
10 different translations.
Yeah, I think that's all of our experience.
So that was all right. I mean, we're getting to the end of this podcast. I just want you to have a final comment. So let's start with Jose, Anna-Michelle, and you.
Well,
So
first of all, I didn't acknowledge to thank you for inviting us here. So thank you for that. And I think this will come out after the elections, but we are here to stay. We're here to grow. Let's keep fighting for social justice for our Latinos communities.
As someone who is also identifies as Puerto Riqueña and understands the dynamics of what's happening with Puerto Ricans here in the United States and Puerto Ricans in Puerto Rico, we are here to work together, and I call upon the Boricuas that do have the ability to vote to make their voice heard. And that will matter regardless of whether we're talking about right now the presidential election, your local election, right? Getting involved in grassroots efforts and having your voice heard.
And we've shown that the Civil Rights, Act that improved access to election and to the right to vote to African American communities improved the health of those communities.
Yes.
We could measure with different index. So I'm sure it would be good for the public health state of Puerto Rico to have these voting rights, and they are essential.
I think I would like to end with saying that the Latino voice is powerful, and when we come together, we can act in solidarity and make our voices heard. And once we make our voices heard, we can enact change. So we just need to work together to make change happen.
Absolutely. Thank you for following this podcast. I'm here with our colleague, Jose, Anna-Michelle, and Cynthia. These colleagues have been producing a fabulous supplement of AJPH, and I invite you to look at it on our website. Thank you very much. Thank you for your time. It was a pleasure.
Thank you. Likewise.